Hello, and welcome to the Care Team Insurance and Financial Services Agent Overview of the Affordable Care Act. The agenda of this training is sister roles, agent versus the navigator, Affordable Care Act's impact to healthcare, minimum essential coverage, what is the marketplace, FFM versus state-based exchanges, key definitions, what is the APTC or subsidy, what is cost sharing reduction, requirements to qualify for assistance, the different metallic tiers, the FPL income chart, as well as customer service. So starting off, we're going to go over agents and brokers versus navigators. As you can see, they both do not cost you money to use. They both can help you apply for a subsidy. They both can help you understand plans that are on a government exchange. Where they differ is that only a licensed agent can help you understand plans that are not on a government exchange, can recommend a plan based on your individual needs, can act as your advocate if you have a problem with your insurance company, and is required to have a license in every state. So what changes did the Affordable Care Act implement? The first thing it did is it created a marketplace, which is one location that a consumer could go to and they can find major medical insurance policies in one location, one place. It created subsidies, which subsidies help reduce the monthly cost of the health insurance. It created cost share reductions, which help to reduce the copays and deductibles that are on certain plans. It created minimum essential coverage. There used to be an individual mandate that if you did not have insurance, you'd have to pay a penalty, but that is no longer applicable. And to me, the biggest thing that it did was it made health insurance guaranteed to be approved without any pre-existing condition clause. And the only thing that changes the pricing is the age, location, and whether the person is a tobacco user or not. I will say that there are plans that are not on the marketplace that are called limited medical plans or short-term medical plans. And what those plans typically do not have is minimum essential coverage. And they also do not cover pre-existing conditions, and they are not guaranteed to be approved. So here are the 10 minimum essential requirements that a major medical plan that is on the marketplace or a government exchange has to have. They must cover prescription drugs, they must cover rehab and habilitative services, laboratory services, pediatric services including dental and vision, preventative and wellness services, ambulatory patient services, emergency services, hospitalization, mental health and behavioral health treatment, as well as maternity and newborn care. In addition to the fact that short-term medical and limited medical plans do not have to cover these 10 minimum essential requirements. I'll tell you from my experience, they have limitations on how much they're going to cover you for hospitalization. They typically do not cover maternity and newborn care, and they also will have a maximum on how much they'll cover an individual for the year overall. So within the marketplace, you're going to hear on exchange, and you're also going to hear off exchange, where they both have 4 different metallic levels. They both are guaranteed acceptance. They both cover pre-existing conditions. The area where they differ is that on exchange, you'll find primarily HMO or HMO open access plans. There are lately, though, some carriers that do offer PPOs on exchange. Off exchange, you'll find more PPO options from the carriers. But the main difference is on exchange is where you're only going to be eligible to get the maximum financial assistance if the person qualifies. Whereas off exchange, the client is responsible for 100% of the premium and out of pocket. So with that being said, 90% of people focus right here on exchange because they want to try to qualify individuals for credits to make the insurance significantly cheaper. So now in order For you to get certified to sell on the federal facilitated marketplace, which is healthcare.gov, there's 5 steps that you would have to take. Step 1 is you're going to have to create an account on portal.cms.gov. Then you're going to identify yourself as an agent or broker. You're going to confirm your identity. You're going to take the required training, as well as sign the privacy and security agreements. This, by the way, is also the same site that you would go to if you're trying to register to be a navigator. So there are federally run, which is FFM, healthcare.gov states versus state-based exchanges. So this chart shows you every one of the dark blue and light blue states are states that are operating on the federally run marketplace. So what that means is that with the certification on the previous screen that I just shared with you, once you've completed that certification, as long as you have a non-resident license in each of these dark blue and light blue states, you'll be eligible to submit business with that one certification. On all the green states, those green states are state-based marketplaces. So the green states like Pennsylvania, New York, Colorado, California, they each have their own training and certification that you need to do. In addition to, you cannot submit those cases on Health Sherpa. You would have to go to the state's specific exchange to submit business there. So if you're just getting started, I typically recommend just focus on the dark blue and the light blue states. If you want to expand, get non-resident licenses and work in those areas. But if you have a lot of opportunity in these green states, then it may make sense. But remember, you have to do a different certification and you have to go to a different platform to submit the business in the state-based exchanges. So here's some key definitions. So the Affordable Care Act is the comprehensive healthcare reform law that was established in March of 2010. Sometimes it's known as ACA, PPACA, or Obamacare. The law's primary goal is to make affordable health insurance available to more people. The law provides consumers with subsidies, known as premium tax credits, that lower costs for households with incomes between 100% and 400% of the federal poverty level. Pre-existing condition is a medical condition that was diagnosed prior to enrolling in the health plan. However, marketplace plans cover pre-existing conditions without a waiting period. So if somebody needed to have a procedure done, they didn't have insurance before, they signed up for this policy, they're eligible to get coverage without having to wait any term or time to get that coverage. Federal poverty level is a measure of income issued every year by the Department of Health and Human Services. The federal poverty levels are used to determine your eligibility for certain programs and benefits, including savings on marketplace health insurance and Medicaid and CHIP coverage. Open enrollment period is the yearly period when people can enroll in a health insurance plan. For this upcoming year, it's starting November the 1st, and it's going to run through January 15th of 2023. Outside of the open enrollment period, people generally can only enroll in health insurance if they qualify for a special enrollment period. You qualify if you have certain life events, like getting married, having a baby, or losing other health insurance coverage. A referral is a written order from your primary care doctor for you to see a specialist or get certain medical services. If you have a plan that requires a referral and you don't get a referral first, then the plan may not pay for that service that was done. HMO stands for Health Maintenance Organization, which is a type of health plan where services are covered only if you go to doctors, specialists, or hospitals in the plan's network, unless if you have an emergency. So if you're traveling, you didn't have any intentions on going to a doctor, but something happened, then the HMO would cover you because that's an emergency. But it doesn't allow you to schedule visits to doctors that are not contracted in the plan. In addition to that, HMO plans typically will require you to visit a primary doctor first and then get a referral if you needed to go see a specialist. EPO stands for exclusive provider organization, which is a type of health plan where services are covered only if you go to doctors, specialists, or hospitals in the plan's network, except in an emergency. So EPO and HMO are very similar. The difference with the EPO is that EPO plans typically do not require a referral to visit a specialist. POS stands for point of service, which is a type of health plan that contracts with doctors, specialists, or hospitals to create a network of participating providers. You pay less if you use in network providers. However, you can use doctors, hospitals, and providers out of network for an additional cost. POS plans require the member to go through a PCP as their point of service doctor and typically will require referrals to see a specialist. PPO stands for Preferred Provider Organization, a type of health plan that contracts with doctors, specialists, or hospitals to create a network of participating providers. You pay less if you use in network providers. However, you can use doctors, hospitals, and providers out of network for an additional cost. So similar to the POS, but the difference is that the PPO has more flexibility in which you do not have to specifically indicate a primary doctor and you do not need a referral if you want to go visit a specialist. A deductible is the dollar amount you must pay each calendar year before insurance begins to pay for certain health services. You pay the plan deductible first, then there may be coinsurance or co-payments that apply. And not everything needs to be paid by a deductible before you have coverage. And I go more into that over time. Out-of-pocket maximum is the most you could pay for covered services in a plan year. After you spend this amount on deductibles, co-payments, and coinsurance, your health plan pays 100% of the cost of covered benefits. The out-of-pocket limit doesn't include your monthly premiums, and it also doesn't include anything you may spend for services that your plan does not cover. Coinsurance is the percentage of costs of a covered healthcare service you pay. So, for example, 20% after you've paid your deductible. Allowed amount is the maximum amount a plan will pay for a covered healthcare service. May also be called eligible expense or payment allowance or negotiated rate. Chiropractic care typically has an annual limit on how much you could, or on how many times you could visit the chiropractor. But aside from that, there's unlimited coverage to see your doctor, to see your specialists in the hospital, within the marketplace. More of something to be concerned about if you're looking at like a limited medical plan or a short-term medical plan. And then co-payment is a fixed amount, say $20, for example, that you pay for a covered healthcare service. Co-payments, sometimes called co-pays, can vary for different services within the same plan, like drugs, lab tests, and visits to see a specialist. Now, prescription drug benefit definitions are formulary. So a list of prescription drugs covered by the insurance plan offering prescription drug benefits, also called a drug list. So every one of the insurance companies have a formulary that's unique to them. Step therapy is a restriction on insurance coverage that requires patients to prove that less expensive drugs are ineffective before getting coverage for a more expensive, higher tier drug. Generic drug is identical to the brand name drug in form, safety, strength, quality, and intended use. Although identical, generic drugs are substantially cheaper than their brand name counterparts. So on that note, I'll mention that every one of these insurance carriers have step therapy. They want the applicant to first take a lower cost drug, a generic drug, and only if that generic drug was taken and it did not work well for them, then they would be eligible to take a higher cost drug like a brand name drug or a non-preferred brand name drug. So brand name drugs are more expensive than generic drugs, and not every brand drug has a generic equivalent. Non-preferred brand name drugs generally are higher cost drugs that have recently come onto the market, so they're newer drugs. And then a specialty drug is a high cost medication that's used to treat a chronic or complex condition. So I will tell you that majority of our customers are going to be taking generic drugs or brand name drugs. So what is advanced premium tax credit, aka the subsidy? So it is a tax credit that helps pay the monthly cost of health insurance, and it's only available on the marketplace on exchange. If you go off exchange, there is no subsidy available. The amount of subsidy is based on the household annual income. The subsidy is paid directly to the health insurance company. It's not paid to the applicant. When the applicant files taxes, he or she must file the Form 1095A, which explains the amount of subsidy received in the year. If the applicant received more advanced premium tax credits than eligible based on their final income, the applicant will have to pay back the excess when he or she files their federal tax return. If the applicant received less advanced premium tax credits than they're eligible based on their final income, the applicant will get the difference as a refundable credit when he or she files their federal tax return. So again, the APTC, what it does is it reduces what individuals would have to pay monthly for health insurance. So say somebody had a plan that's supposed to cost them $500 a month based on their income. If they get the APTC of say $450, $450 would be paid on their behalf. They would only be left to have to pay $50 per month. So cost sharing reduction is different from the APTC because the APTC pays the monthly cost, whereas the cost sharing reduction lowers the deductible and co-pays that the individual would have to pay. So in the health insurance marketplace, cost sharing reductions are often called extra savings. So when you fill out a marketplace application, you'll find out if you qualify for premium tax credits and extra savings. You can use a premium tax credit for a plan in any metal category. But if you qualify for the cost sharing reduction, you'll get those savings only if you pick a silver plan. And if the individual you're speaking to is a member of a federally recognized tribe or Alaska Native Claims Settlement Act corporation shareholder, they may qualify for additional cost sharing reductions. So what are the requirements to qualify for assistance? Two main requirements. First is that they must have a legal status in the US. So they're a citizen, they're a resident, they have a work permit, they have a visa, they're in the process of obtaining a work permit. As long as they're legally here and they can provide some form of documentation, that would be checked off. The next item is that they must file a tax return for 2023. So even if they hadn't filed taxes in the past, as long as going forward, they're going to file taxes and reconcile whatever they should have done in the past, they'll be eligible. And proof of income is either from an employer, job, W-2. It could come from self-employment, Form 1099, or other sources. Just ask them, what are they doing to earn income? And children can be on insurance along with their parents up until age of 26. So who doesn't qualify for APTC or CSR? If the individual is eligible for Medicaid, if they qualify for CHIP in their state, if they're eligible for Medicare, if they have veterans or military coverage, or if they have an employer that offers them affordable group coverage. And affordable means that that coverage is not more than 9.12% of their income. If it's more than 9.12% of their income, then it's not affordable and they would qualify. So inside of the marketplace, you'll find that there's hundreds of different plans, but there's only 4 categories. So if you start from the bottom, bronze, if an individual took a bronze plan, 40% of the costs to use the plan is going to be paid by the individual, and 60% is going to be paid by the insurance company that they go with, and this is going to be the lowest cost plan. Silver is 30% out of pocket by the individual, 70% cost to the insurance company, and it's going to be low premium. If they go gold, the individual is only responsible for 20%. The insurance company covers 80%. The premium is going to be higher. And then the very best plans are platinum, which 10% is going to be out of pocket to the individual that's enrolling, 90% out of pocket to the insurance company, and platinum plans would be the most expensive plans. So in this chart right here, even though there's hundreds of plans that are out there, if a plan is under the gold category, what it boils down to is that 80% of the bill is going to be covered by the insurance company, 20% by the individual. If they take silver, 70% by the insurance company, 30% by the individual. But silver is what I want to kind of focus on right here, because remember earlier I mentioned that if you're eligible for cost sharing reduction, that is only going to apply on the silver plans. So here's a chart, and I want everyone to have this chart somewhere that is very easy for them to see as they're enrolling people, because this is going to help you know where people fall. So if we start from the bottom, remember we just mentioned silver plans cover 70% of the bill. So depending on the person's income, they could get a silver plan that covers more. So if the person makes $33,976 and above, they're just going to qualify for the standard silver plan. But if their income as an individual is between $27,000 to $33,000, they're going to qualify for a silver plan that covers 73%. So remember, the standard silver plan covers 70%. This silver plan is going to cover 73% of the out-of-pocket expense. If their income is between 150 to 200% FPL level, which is 20,000 to 27,000 as an individual, their silver plan is going to cover 87% of the out-of-pocket. So this specific silver plan is better than the standard gold plan. If the person's income is between 100% to 150% of the FPL, which is $13,590 up to $20,385, then they're going to qualify for a silver plan that covers 94% of the out-of-pocket. So this silver plan at this income level is actually a better plan than the standard platinum plan that only covers 90%. And one thing I want you guys to know is $1 off. So if the person makes $20,386, they don't qualify for this 94% plan, they'll qualify for the 87% plan, right? So this chart is going to be very helpful for you to know where people fall. And then down here, this is the chart to show where the person's FPL level is. So to the left, you have the household size, and then you have the minimum amount that an individual could make up to the maximum amount that they can make. Due to the American Rescue Plan, the government increased the FPL limit to a little bit over 400%. So in some scenarios, people with this level can qualify. So that's why we have that in there. But how to understand this chart is, if you're a one-person household, so you're single, you don't have any dependents, no children, it's just you on your tax return, this is the least amount of money that you can make. If you make $1 less than this $13,590, you're not going to qualify for assistance. And you can make all the way up to $67,950. And depending on your age and your location, you'll still get credit. Now, if it's a three-person household, so just say one individual with two children, the minimum they can make is $23,030, upwards of $115,150. So this is important here because this chart is based on the household size. So when you're asking people who's in your household, you need to find out everyone that's on their tax return, not just who is going to be applying for the insurance. Because based on the amount of people in their household, is how we're going to know what they qualify for. And then when it comes to income calculation on the marketplace, it's asking individuals for estimated income for 2023. So it's impossible to know how much money you're going to make next year because it's still a whole year away from today. So what we're doing is we're estimating based on how much they make currently, and if they're self-employed, we could use how much they've been making, in the past as a gauge to do a good estimate for them. So if they're getting paid hourly, you're just going to get the number, how much they make per hour, number of hours they work per week, and you're going to calculate that by 52 weeks, and it's going to give you an estimated annual income for them. Biweekly is the same thing, but by 26 weeks. And if they're self-employed, what we need is their adjusted gross income, which is their income after all their deductions. If they don't know what that is, ask them to verify line number 11 on their most recent 1040 tax return. What I found is that a lot of individuals that are self-employed are eligible to get credits, and they didn't think they were. So they may gross 100,000, but after all their deductions, they only made 30,000. That 30,000 is the amount that we would use to estimate their credits. So here's a chart to just give you an example on what I just mentioned. We're going to focus here on carrier 1 and carrier 2. So this is an example of two different carriers with somebody that qualified to get a 94% silver plan. So to the left on carrier 1, it has a $675 deductible versus carrier 2 has no deductible. Maximum out of pocket is $675 versus $1,250. Primary is no charge versus $1. This plan does not require referral. This plan does require referral. Specialist is $5 versus specialist is $10. Now, up until this point, you would say that this plan with carrier 1 is the better of the two. But then you'll see where it varies. Is if you needed to get a lab or x-ray done, you first have to pay your deductible on this plan versus you only have to pay $4. So $675 versus $4. The same for the emergency room, $675 versus $125. So essentially, that's why these plans are both factored in at 94% of the benefit is going to be paid out by the insurance company, with 6% paid out by the consumer that's using it. So just be comfortable and content to know that, if you're looking at a plan and if it's in a specific metal tier, even though the copays and the deductibles vary, ultimately it's going to boil down to that percentage is going to be what we pay and the percentage that the insurance company pays. So when the marketplace needs more information, so if an applicant is asked to verify or add to information entered on his or her marketplace application, they will get notices, letters, emails, or both, telling them which documents that need to be submitted. They're going to be required to send documents to the health marketplace that is in their eligibility letter, which typically is proof of income, immigration, citizenship, or other. It'll be very specific as to what they need. For citizenship and immigration issues, the marketplace typically gives 95 days for them to submit that document. For other requests, the individual will have at least 90 days from the date that they receive the eligibility notice. So that's usually the date that the application was completed to resolve the health insurance issue. Now, within those 90 or 95 days, their coverage is going to be active. They're going to be eligible, but they need to submit those documents before the deadline that's going to be on their eligibility results. So what happens if the applicant misses their deadline? If the applicant does not meet their deadline, the marketplace will make a new determination of eligibility based on information from the marketplace's data sources versus what was put on the original application. So the new results may change the current insurance eligibility and cost. If the applicant was found eligible for a premium tax credit, the amount could change or they may lose it entirely. If the applicant was found eligible for savings on out-of-pocket costs, known as cost sharing reductions, the amount could change or they may lose these savings entirely. If you told us someone on the application is a US citizen or a US national or has eligible immigration status, but they did not submit the required documents in time, their health insurance is going to be terminated. So documents that can be submitted for proof of income, their most recent tax return, a W-2 or 1099 form, paycheck stubs, self-employment documentation, social security benefit letter, proof of legal citizen status is a U.S. passport, naturalization certificate, certificate of citizenship, or U.S. public birth certificate. Proof of immigration for non-citizens, permanent resident card, a clear picture of the front and back of it, work permit card, front and back of it, check-in and check-out form, I-94 or I-94A, a social security card, or they can also use a tax 1040 form. And then proof of non-Medicaid coverage, they would just need to get a letter from Medicaid stating that they do not have Medicaid coverage. So how and where can the customer send copies of documents ordered by the health insurance marketplace? They can upload copies of documents to the health marketplace website or Health Sherpa directly, or they could mail it to the health insurance marketplace. But what I'm going to recommend and advise you is that have your customer send you the documents. Provide them with options to where they can text it to you, email it, or fax it. Remember that this is an intangible product. There's nothing that we're giving people physically besides what we're telling them and the paper that the insurance company is going to send them. So the best thing you can do is try to service your customer in every situation. It'll go a long way. So if they're going to send it by mail, inside of the eligibility result that they're going to get, there's going to be a page that has a barcode. Have them enter his or her name on along with the application ID on each page that they're going to send, and then they're going to mail it to the health insurance marketplace at this address here. And all this information is included in their eligibility result as well. So the type of payment methods that are acceptable, the best payment method is a checking account. So this is the preferred payment method, as this routing and account number typically do not change as often as debit and credit cards do. A debit card would be the second preferred method for payment with the different insurance companies. Credit card works as well because most carriers accept the credit cards, but typically only Visa and MasterCard is accepted, and some carriers will only allow a one-time payment with credit cards. So that's why checking and debit is typically preferred. And then most carriers work with MoneyGram or offer a way to pay by mail. So here's the opportunity that we have in front of us. So as of 2023, the family glitch is fixed. And inside of this family glitch, there's over 5 million people that are currently affected by the family glitch. And really what the family glitch is that if someone was offered affordable insurance from their company, their dependents were not eligible to go to the marketplace and get subsidies and tax credits. That is no longer the case. In addition to this, we have 26 million people today that do not have insurance in the US. And out of those 26 million, 11 of them are not elderly adults. And what we found is that 3 out of 5 of the uninsured can likely find a zero premium plan on healthcare.gov. 4 out of 5 of the uninsured can find plans that cost less than $10 per month on healthcare.gov. In general, more than 90% of people that applied on healthcare.gov received some form of financial assistance. So this is not sales. We are simply guiding and enrolling. Seize the opportunity. With that said, I want to thank you for your time and attention, and I want to advise you to see the sales process training video next. And here's how you can reach us. Thank you.